Welcome to the Explainer. Today, we're going to talk about something serious, a condition that can sneak up on you, starting with a symptom that's super simple and incredibly common.
So let's start at the very beginning. Let's put ourselves right in the shoes of someone who's just starting to worry, asking themselves this one question. This feeling, it's the classic first sign, but really, it's just the first clue in a pretty complicated medical mystery. It usually kicks off with feeling winded when you're doing something physical. But here's the really frustrating part. The early signs, they are so vague. It's the kind of thing you could easily brush off, right? Oh, I'm just out of shape, or, well, I'm not getting any younger.
And it's not just about being a little out of breath. Look at this list. We're talking about a whole collection of things that go way beyond that. This is a deep, draining fatigue, feeling dizzy, your heart racing, even fainting. All these things are basically your body screaming that something is wrong. But the problem is, they don't point a big flashing arrow at any one specific cause.
Okay, so if this mystery isn't solved, the body starts sending out much louder alarm bells. We're talking about things like edema, that's swelling, usually in your legs, sudden weight gain, and a swollen belly. Now, these aren't vague anymore. These are the classic textbook signs of right-sided heart failure. And what that means is the right side of your heart is working way too hard, just struggling to push blood through the lungs. So that's the big question, right? With all these confusing, vague symptoms at the start, how on earth do doctors play detective and figure out what's really happening? This is where having what they call a high index of suspicion is just absolutely essential. And this right here, this number really drives home the challenge. Think about this. On average, it takes more than 2 years from when someone first feels symptoms to when they actually get a diagnosis of pulmonary hypertension. 2 years. That's a long time, and a delay like that can have really serious consequences. That's why we need to walk through how they actually figure this out. It's not a simple blood test, that's for sure. The path to a diagnosis is a real step-by-step process. It all starts with a deep dive into your medical history and a physical exam. From there, an echocardiogram, which is basically an ultrasound of your heart, can give a pretty good hint that the pressure in the lungs might be high. If the suspicion is strong enough, that's when you get sent to a specialized center for the gold standard test, a right heart catheterization. That's where they can go in and directly measure the pressure. No more guessing.
Okay, so after all that detective work, what does the diagnosis actually mean? What is pulmonary hypertension?
All right, so at its core, pulmonary hypertension, or PH for short, is pretty much what it sounds like, high blood pressure. But, and this is the key part, it's specifically in the arteries of your lungs. I like this analogy. Think of the blood vessels going to your whole body as a high-pressure plumbing system, right? Built for power. But the circulation in your lungs, that's supposed to be a gentle, low-pressure system. pH is what happens when that low-pressure system gets all clogged up and the pressure skyrockets.
And this comparison here is just so important to understanding the problem. Your heart has two sides, and they have very different jobs. The left side is a beast, a powerhouse built to pump blood to your entire body. But the right side is designed for a much easier job, just gently pushing blood through those low-pressure lungs. So when the pressure in the lungs gets cranked up, that poor right side of the heart is forced to do a job it was never, ever designed for. And that leads to strain, and eventually it just can't keep up. And here's another layer of complexity. PH isn't just one single disease. It's really an umbrella term for 5 different groups, as you can see here in this WHO classification. The why behind the high pressure can be totally different. It could be problems in the lung arteries themselves, or it could be caused by left heart disease, other lung issues, or even old blood clots. Nailing down which group a patient falls into is everything, because the treatment for group 1 is totally different from the treatment for group 2.
Okay, so we have a diagnosis. We know the group. Now what? How do you manage this? Well, the good news is the approach to treatment today is super strategic and really personalized. This quote right here really nails the modern philosophy of treatment. The goal isn't just to manage symptoms and help someone feel a bit better. No, the entire goal is to get that person into what's called a low-risk status. Doctors look at everything: symptoms, how far you can walk, blood tests, and they tailor the treatment to actively shift you into a category with a much better long-term outlook. It's about changing the entire trajectory of the disease. So how do they do that? Well, there's no single magic bullet. Instead, the strategy is to attack the problem from 3 different directions at once. You can see these key pathways here. We have drugs that block the stuff that tightens blood vessels, and then we have other drugs that boost the stuff that helps relax and open them up. It's a full-on, multi-pronged assault to bring that pressure down and give the heart a break.
Now, for the toughest cases, when the medications just aren't cutting it, the options get a lot more serious. We're talking about advanced procedures, even things like a lung transplant. These are obviously huge, life-altering interventions, and they are exactly why you need to be at a top-tier, specialized center that handles these complex cases.
All right, let's bring this all together. What does the path forward look like for someone with PH, and what's the big takeaway for all of us?
This chart, wow, it shows you exactly why getting to that low-risk status we talked about is so critical. Just look at the difference in the estimated one-year mortality risk. It is stark. Moving a patient from the high-risk bar over to the low-risk bar isn't just a number on a chart. It literally translates to a better chance of survival. It's what it's all about.
And here's a point that cannot be stressed enough. Getting the best outcome doesn't happen by accident, and it doesn't happen with just one doctor. The research is crystal clear on this. When you're treated at a specialized center with a whole team of experts, we're talking cardiologists, lung doctors, expert nurses, all working together, the results are just dramatically better. This is 100% a team sport.
So when you look at the whole journey, right, from that first simple feeling of being out of breath, all the way to this complex diagnosis and these amazing targeted treatments, it kind of leaves us with one big important question. Knowing that it can take years to get a diagnosis, it makes you wonder, are we really listening closely enough to what our own bodies are trying to tell us?